Welcome, everyone, to our NCAA Social Series, episode number 27. I'm Andy Katz. Pleased to be joined, as I have been almost every week, with Dr. Brian Hainline, the NCAA Chief Medical Officer. And for this week's episode, we're joined by two new members of the newly formed COVID-19 Medical Advisory Group, Dr. Carly Day, who is a head physician at Purdue University, and Dr. Doug Aukerman, who is an Oregon State Senior Associate Athletic Director, also for sports medicine at Oregon State. So a couple quick things I want to get to right off the top, and then we can dive deeper into, some of the topics related to fall sports and winter sports. And I just want to go right to what has been addressed to me as maybe the most pressing topic right now in sports, and that is contact tracing. And I want to go around our Zoom room here and get your opinions on all of this, because really, as much testing as everyone is doing, and we'll get to the protocols, contact tracing can literally decide whether or not a team is going to play for one particular weekend. We're already seeing it this fall. Or when it comes to basketball, it really could be debilitating for multiple games over the course of a 2-week period. So I will start with you, Dr. Hainline. Contact tracing. Where are we in terms of how you can either get around it, test out of it, or how coaches and schools are going to have to manage that going forward?
Well, you're right, Andy. It's really the most important issue, especially in a sport like basketball, where you have 15 people on a team, and maybe the inner bubble or tier one is going to be 25 or 30 people, but they all have very, very close contact with one another, much more so than in a sport like football even. So, there aren't enough contact tracers in this country to begin with. So one of the things that's really important for each school, you can train to be a contact tracer, and then you actually then report into the local public health authorities. And so the schools, if they train their staff to be contact tracers, they have a much better understanding, boots on the ground, about who has been interacting with whom, and they aren't acting as independent entities. They still become part of the local public health decision making. So that perhaps is the most important thing that every school should do, is to ensure that there are enough contact tracers to help make the decisions. But I think Carly and Doug, they have a much better appreciation of the nuances of this, when they've seen it with how it has to happen in different sports practices. So I'd love to hear their take on that.
Yeah, go ahead. Start you, Dr. Day, because, this is really, I think, the most pressing issue of, even if everyone's negative on your team and one particular player, knows someone who's been hanging with someone who's positive, and you keep testing negative, how does that affect that team going forward if they have to sit, 7 to 10 to 14 days, yet every time they test, they're negative?
Yeah, it's such a tricky topic, as you can imagine. And one of the things that we struggle with is this, a lot of people have heard the less than 6 feet for greater than 15 minutes, but that's not a perfect answer. That's just us saying, yeah, there's been some old studies that looked at droplets of other viruses, and that's about how far you had to be and about how long you had to be. But it's not like if you're 7 feet, you can't get it. And if you're 5 feet, you're definitely going to get it, right? So the first part is it's just a flaw in trying to figure out who is a close contact. So some of it is you do have to use what's been put out there by the CDC and the departments of health. But the first flaw is even trying to figure out who is a close contact. No one's ever defined it truly scientifically in sports. It's a lot of inferring or trying to figure out, if we know how it's spread, what's the best way to guess who's at risk within a sport. So again, even the basic science behind it is tricky before you get into all the complicated parts beyond that.
Dr. Aukerman?
Yeah, absolutely. One of the biggest challenges I think we have in front of us to figure out how to get through a competitive season of any sport without major stoppages. The different county health departments and state health departments are all interpreting how to do contact tracing just a little bit different, and each one of them has a little bit of a different nuance. And that will impact each school differently. clearly all of us and all of our institutions can help with the contact tracing. We know the activity that's going on at the university. We know what the standard practice is like and where that high risk contact is going to be. We actually can have access potential to video footage where we can sit and go back and actually help with that timing. But it's important to note that the CDC and many states actually count that 15 minutes as cumulative time over a 48-hour period of potential infectiousness. It becomes more challenging in that the contact tracing principles were really designed around a group of people who didn't have frequent testing or even daily testing. And so to try and then design a way to contact trace that mirrors or is tied to our testing algorithms is certainly a challenge.
So that's a great point. And I think that's where athletics at this level separates. So if you are testing 3 times a week, or we get to the point where it is actually daily testing, which we hope we will be in November, December, what are the chances, and if all 3 you could answer this, that if you're testing every day or at a minimum 3 times a week, how much time has to go on to where you can say, yes, I know you were near someone who's positive, but every time you test, you're negative, you can play. What's the timeline for that specifically, do you think, where a coach, an athletic director, a school can feel comfortable putting his team on the floor for competition or even practice, just, you know, when he keeps seeing or she keeps seeing negative tests?
Yeah, I mean, I would comment, I almost make it more simple than that. So you're talking about if someone's exposed to testing them multiple times, but there's even discussions of someone who has it, that if you're testing every day, the first day that they test and they test positive, is that the first day they're actually infectious? Like, were they actually infectious the day before if they tested negative that day versus the day after where they do test positive? And there's some good science behind that, saying that, you know, you're probably catching them before they're infectious if you're testing daily. And so that actually, in theory, could help contact tracing significantly, but you still need the support of your Department of Health. You know, you can't just make those decisions without their support.
Doug?
You know, the other piece about contact tracing is then the resultant quarantine period, right? And so the current quarantine period is 14 days under the presumption that the incubation period may extend out to 14 days before somebody actually becomes infectious. And you could still be testing negative for all that time during the incubation period before you turn positive. You know, I think we need in sports to really look strongly at the possibility of testing at periods during that quarantine period, looking at the science behind the number of people who actually turn positive, when they turn positive, and maybe come up with a more defined and more prescriptive quarantine period to be related to sports as opposed to general public.
So to wrap up this topic, Brian, you know, what would be your recommendation? Because I'm hearing it, and I'm not, you know, a medical person, about, you know, if I keep testing negative, my team, no one has it, but they were in contact with someone that did, or one person was. When can my team practice and play? What will be the advice that this board, or, you know, would grant to an athletic program?
Well, so the advice is, what's the science, which Doug is talking about? And I think sport is going to define a lot of the science of COVID-19. And it's that versus where are we with the local public health officials? And so actually our call on Tuesday, just a couple of days ago, the most intense discussion was all about quarantine and can we really test out of quarantine? And even though scientifically, we thought that was really a good possibility, even doing something like testing on days 3, 5, and 7. If that's negative, you know, the confidence intervals that person's not going to be infectious are pretty high. So people could agree on that. But the real fact of the matter is that the local public health officials, some are going to say it's 14 days no matter what. The CDC is at 14 days. And as long as you have that, then you can't move into an algorithm where you're going to have some places where you can test out of quarantine and others you can't. because the local public health officials are all over the place. And so it becomes a competitive equity issue. So hopefully, through all the data we're gathering, we're going to be able to guide where things go. But right now, we're at a place where we have to say, well, it's 14 days because that's where our country is, and we don't quite yet have the science.
All right. Well, I appreciate that answer. And that's where we are at this point here in late September. Carly, in terms of the advisory board, what do you think, outside of contact tracing and quarantining, what are some other real headline issues you think need to be addressed at this juncture as everything keeps changing and evolving, hopefully for the better, over the coming weeks and months?
Yeah, I mean, obviously testing just comes up every single meeting. It's such a big topic, and that is something that evolves. You know, science is slow, but business is fast. People are working hard to develop different technologies to test. So even though we're waiting to figure out the best thing, new tests, new technology are coming out every day, and even old tests are getting faster, which helps us. And so that clearly is a topic that continuously gets talked about, and just evaluating the new technology and figuring out if we think it's, you know, feasible financially, if it's feasible logistically. We can't have, you know, the sports medicine staff doing testing every day when they need to be taking care of the athletes. So there's a lot that goes into that.
Doug?
Yeah, I think we got to really add on to that great answer is that we have to really look at the infrastructure and also the resources and the ability and capacity for all the teams across our country playing basketball. You know, you have schools that are in small towns that may not have a large reference lab or a hospital lab that they can get access to. And so it may become more difficult for them to be able to accomplish the same kind of testing algorithms or procedures that we all are going to recommend or deem as what is the minimum level for safety. And I think we have to be cognizant of that and make sure that the plan put forward takes into account all of those nuances.
So, Brian, let's deal with what the recommendations were. This was from the Medical Advisory Group, you know, previewing guidelines for basketball from the Sports Science Institute. 3 times a week. That's what the recommendation should be for testing for the sport of basketball. And to Doug's point, you know, most power schools certainly can accomplish that in some form or fashion, depending on what the tests you're using. Lower level leagues may have a problem with that. So how do you get through that?
Well, it's really a challenge, and it's sort of a metaphor for how do we get through that in our society. I mean, if we really wanted to re-socialize from a business point of view, from a school point of view, testing would be widely available and it would be free. I mean, that's how we get our country back, and we're not there. But I think Carly brought up a really good point when she mentioned the word feasible. So what really is feasible? So doing PCR lab-based testing is not feasible because we're moving unbelievably yet again into a prioritized basis of way of doing testing because we don't have enough reagent in some areas of the country. So what has really rapidly evolved are what's called the point of care antigen test. So it's different than a PCR test, and that probably is going to be really widely available come January. It's important to note that some of the point of care antigen tests, Health and Human Services, they have bought out, you know, even ahead of time, ahead of the production time for these tests, up until about January. But that's when there's probably going to be an explosion. So when we were discussing the 3 times a week, we had in mind that it doesn't necessarily have to be PCR. It could be antigen, and that was really moving forward to the place that point of care antigen testing will be so widely available, it's going to be the most feasible to do. But getting to the cost, right now, even that test is not inexpensive. I mean, rock bottom price, probably the lowest price you could get would be about $23 a test. We know that come January, there's going to be some point of care antigen tests that will be $5 a test. So that will be the game changer. And so right now, unfortunately, some schools, they can't do the sport the way they would like to because they don't have the infrastructure support to do the testing, or they don't have the financial support to do so. And that's a shame.
So Carly and Doug, to the other aspect here, like the officials, they obviously need to be tested. What about every other person that makes a game work, whether it's the stat people, any essential media to actually broadcast the event, operations? What would you both like to see or advise for all those other people that put together an event in terms of how much and when they should be tested?
So one of the things I think we really have to look at is um, you know, all of these policies and all of these procedures that we're putting in place are only as good as the weakest link. And so you're absolutely right. We have to take into consideration, how do we manage the testing of the coaching staff, or of the student managers, of the athletic trainers, of if a physician travels, the media that it surrounds the event. And I think that does have to be taken into account. And we have to make sure that there's appropriate levels of testing that, again, are reasonable and feasible to have a good sense that they are not bringing asymptomatic COVID into the environment.
Carly?
Yeah, I think some of this is figuring out, where are our priorities. And when we always say, we really want to protect the student athletes, their health and wellness. So it's figuring out, who is in close contact with these people. There may be people in the past who were in close contact with student athletes who don't need to do that right now, right? So I know, a lot of people are doing media interviews through Zoom, just like we are. And, those are the questions are what are the ways that we can protect from unneeded interactions? And then the interactions that are needed, how do we keep them safe? Whether it's we're testing those people or we're figuring out a way to do it spaced, with appropriate distancing. So it's just people have to get used to doing things a little differently than they had been in the past, which sometimes can be tough since, I think a lot of people around sports are creatures of habit.
I mean, I guess I was thinking like in a football game, and now we're outside for that. Even the personnel that's holding the yard marker, where they're standing, players are going back behind them. So there are all these sort of people that we don't always think about that are part of game management. Now you take the event and you put it indoors, and there are people, and we're seeing what the NBA and the WNBA are doing. Obviously, they're constructing basically these little glass bubbles on the sideline, and sometimes they're moving the stat crew to the other side, so they're away from the benches, but they're still in the building. So how many other, we can go start with you, Brian, in terms of, the game management indoors, maybe even leaving windows open or doors, which could make it colder, certainly as we get into the winter months. But what are other aspects of an indoor event to, make the entire event as safe and healthy as possible?
We start off with the large issues first, and that's the ventilation. So ideally, the better the ventilation, the filtration systems that are in place, that's the ideal thing. So, and that we've actually provided that guidance in the last resocialization document that we put out. And then it's the separation. And so it's when in this current document, we talk about tier 1, tier 2. Tier 1 are all the people that really interact at a very close level on a regular basis. And those are the ones that are tested 3 times a week. Tier 2 are people who are essential to run the event, but they don't have to interact with the tier 1 individual. So you make certain that they're always separated. So the NBA has done that model with the plexiglass and so forth. And that's what's going to have to be done at every single game. The essential individuals who are not part of tier 1, they don't even enter into that space. And that's what's key. So the NBA has done that successfully. Another event that just was completed, the U.S. Open, they had a clear demarcation between tier 1 and tier 2, and it worked essentially flawlessly. So that's what we're going to have to do going forward.
Arlene, Doug, if you could comment on that.
I think this virus and this pandemic has forced us to try and take a step back and really think hard about what just was the normal way of doing it. And are there some changes that can happen, whether it be, passing out stat sheets, whether it be electronic ways of tracking that kind of information, how close to people stand benches. I think there's a lot of additional kind of nuances that we can look at and consider in terms of trying to make this a safe environment for our athletes to participate.
Carly?
Yeah, again, I think we've sort of said it all, but I would say, as we're saying, there are people we think we can keep separate, but officials really are quite intertwined with athletes, both in football and basketball. When we're on the sidelines for football, I would probably meet close contact, criteria with a linesman at some time, depending on how much movement there is on the field. So, the officials really are going to be in that tier one, and really we need to make sure that they're not bringing the virus in, because they're around athletes, coaches. Think of how many times you've seen coaches and referees very closely interact in different ways. So I do think it's important to make sure the officials are, tested, and we make sure they don't have it.
So two things related to that, and I want to get, to the expectations of this board, Brian, in a moment. But, first off, we have seen already in the NFL, there's been a mandate. There have been fines, 6-figure fines of individuals and teams for wearing that mask like a chin strap instead of over your nose and mouth. We don't have that ability, at the NCAA to fine people for a regular season game. But what would you like to see from these conferences? And Carly and Doug, you're in 2 high-profile conferences in the Big Ten and the Pac-12, of seeing some real strength behind it, some teeth, saying, look, this is what you have to do with that mask if you are not an athlete competing, whether it's a coach or someone that we're just discussing on the side. Carly?
It's such a tricky question, because I think we make comparisons to professional sports a lot, but they really are a different scenario. Our student athletes are still going to classes, and a lot of our coaches still have families with them. So even though you're testing, it's important to protect everybody. But the masking issue is so challenging, because the issue is, are we saying we've tested everybody and they're negative so you don't have to wear a mask, or we've tested everyone, you think there's a very good chance that they're negative, but tests aren't perfect, and it'd be nice to make sure we have one added area of protection to avoid that. And there's debate there, even within sports medicine professionals. And this is to be clear, in public setting, masks are very necessary. This is a different area where there's testing. So again, it's actually sort of a debated issue to figure out how tightly you need to mask, because everyone's being tested.
So I like to look at this as an opportunity for our coaches and our coaching staff and our athletic departments to be role models, and to help the rest of our country see that it's okay to wear a mask, and that there is benefit to wearing a mask. And not everybody's perfect, and there'll be times when the mask comes down because you're afraid your voice is being muffled and you can't be heard as if you're a coach. But at the same time, they're educators. The coaches are educators, and the coaches are leaders. And I would hope that they would be willing to take that on and act appropriately.
So in the non-conference, which the NCAA does not legislate in terms of putting the events on, what we're seeing is more likely going to happen in November and early December in men's and women's basketball, are these sort of mini pods. I don't know if I'd call them bubbles, but where you go to one site, and one of them may be Orlando, and everyone comes into one site, you test, the officials, everyone, and you stay in the same hotel, and you create your sort of controlled environment, might be the best way to term it. And I'm just curious your thoughts on that, because all your teams may be involved in that. And Brian, your recommendations through this board will certainly be adhered to, especially by these third parties that are organizing all these events.
Yeah, and it's an interesting concept. So the multi-team events, I think you can move into a one space, and you have a much better sense of control over a period of several days. And so I do like that concept, and it may be less challenging than, say, in 2 or 3 games where you're going to different cities in 1 week. So we'll see. That's going to come up, but I'm optimistic that can really be pulled off successfully.
If you don't mind me chiming in, I think a lot of it comes down to execution. So, and what's the actual plan for testing? What's the plan for travel? Because we know scientifically, let's say you travel and you're exposed to it during your travel, that if we test you when you arrive and the next day, you are going to test negative. It's actually very, very likely you'll test negative, even if you are going to go on and develop COVID-19. And so some of that is, how is travel executed, right? And were they tested before and after? And there's so many things that really have to be taken into account, that you can't have a high risk exposure, test yourself the next day and feel good that there's no coronavirus around there.
I go back again. This virus, this pandemic, allows us to re-examine how we do things. And is this a possible way forward? May this catch on and be a mainstay for college basketball in the future? I don't know. It could solve several issues as it relates to the pandemic and COVID and trying to keep people healthy. It may also generate some efficiencies that we may like. And I think we have to, as a group, as an NCAA, as a group of conferences and institutions, we have to look at that. That's something that will be a learning experience for everybody if we go down that road.
So, Brian, and I want to get all of your thoughts on this as we get closer to wrapping up here. The expectations of this group, what are they, Brian?
I think first it's kind of neat to talk about how the group came together, because it's some members of the original advisory panel, members from the American Medical Society for Sports Medicine, National Athletic Trainers Association, National Medical Association, the Autonomy 5 Medical Group. We had all been working together anyway, and with the formation of this new group, we all came together as one. I think the most important thing that we hope to accomplish is just being really candid and frank about how we make it safe and how do we really pull off sport, or can we, in the midst of a pandemic that we're still in. And so it's a phenomenal experience because everyone's deeply engaged, and I'm 100% certain that everyone really wants to get it right, and it's a really collaborative group. But then more practically speaking, so we have the resocialization of basketball document, but now we're quickly moving to say, well, how does that apply to all of the other sports? And so the higher risk sports like wrestling or ice hockey, and then you have your lower risk sports like tennis or swimming. And so that's going to be the next phase. But also, I'm certain we're going to be bombarded in the next week with a lot of questions. A document comes out, and then there are numerous questions. So there's going to be a frequently asked questions document where you kind of get into the nuance of how things are pulled off. But basically, it's looking at winter sports and then spring sports and what's the safest way to roll it out.
Arlene, Doug?
Yeah, so I think there's lots of benefits to having these different minds coming together, and there's geographic diversity, right? So there's different rules in different states we have to take into account. There's diversity of the schools we're covering. So some people are covering Division I, and some are covering Division II and Division III. I covered a Division II school for 7 years prior to my job at Purdue. So understanding some of the needs of different schools from different divisions. And then there are people with different medical backgrounds. So we have infectious disease experts, team physicians, athletic trainers. And again, they all bring that collaborative spirit together to try to figure out how to make it happen and how to do it right. And so it's just a really great group of people where everyone is willing to listen to other people who are experiencing this in a different way and try to figure out how to make this happen.
Yeah, the only other thing I would add to both those answers is that it's a group that has enough broad representation, and it affords a lot of opportunity to then go back to the constituents that we work with to get more information, to gather new ideas and bring it back to the group. And so I think it's been very collaborative, and I think everybody has learned something from a different point of view, or something that gets brought up during these conversations. And it's been a very rich dialogue, and I look forward to continuing to be part of it.
All right, so I always like to hopefully end a little bit on a high and be optimistic. And last week, Dan Gavin and Lynn Holtzman talking about the basketball seasons, men's and women's, when the Division I Council announced the start date of November 25th. Got us all excited. The season's going to happen. And look, with football, we're seeing some successes, some setbacks. It's sort of what we expected, that there would be cancellations, postponements because of this. Obviously, 2 months from now is a lifetime in this pandemic. We hope it's going to be better, but we don't know. But give me something that's optimistic, Doug, Carly, Brian, about why you feel positive, hopeful about the winter sports, especially men's and women's basketball. Doug?
We have time to plan, and we have an ability to plan, to put forth a pathway to make this successful. And, I think we still have time as a country to continue to do the right things and socially distance and practice hygiene methods and wear face coverings and help us all out to make sure that we are going to be successful with this basketball season.
Yeah, Coach Painter likes to tell our student athletes to win the day. And I feel like we're all taking that motto, and, everyone's been working hard, and every day we have that day to do the best we can, to learn the most we can, take care of these student athletes, put together a plan, modify the plan when new data is presented. So I think, again, there's just a lot of really dedicated people, and we sit down, take it one day at a time, and I'm just convinced that we have a wonderful group that can make it happen.
And I think the basketball coaches really have a very good understanding of what it's going to take. And, as Doug said, they're educators, and they can educate their athletes and say, look, you want to have a basketball season, this is what we have to do. And I think they're taking that really seriously. The other thing that's positive, Andy, we talked about testing for how many months now. But we really are now seeing the light at the end of the tunnel, where there's going to be a lot of availabilities of rapid diagnostic testing. So that's going to be an important part of how this season can be pulled off.
Well, there's no question that I think as much as the numbers are up and down, we feel positive that things are moving in the right direction. As we said at the beginning, the contact tracing and trying to test out of that is incredibly difficult, especially with what the current CDC guidelines are. No question about that. We'll see if that changes by state or nationally in the coming months, coming weeks. But the other thing I would just say that we've heard many times, we're seeing it in football, which is that it's not going to be a normal sort of equitable season. There are going to be some schools that have setbacks and maybe don't play as many games than others. And that's just, we all have to accept that. But it's not going to be equal in this particular season. As always, these are incredibly educational, informational. I appreciate all of your expertise on the subject. Dr. Carly Day from Purdue, the head physician there. Dr. Doug Aukerman from Oregon State, Senior Associate Athletic Director in charge of sports medicine. Of course, Dr. Brian Hainline, the NCAA Chief Medical Officer. As always, you can go to ncaa.org/social series, where all our social series are archived. And as you'll see, Brian and myself have been tackling this topic really since day one, when everything got shut down in that mid-March period. So we've been on top of this from the beginning with the help of the expertise of all of your incredible, I date myself and say a Rolodex, but your contact list, Brian, has been phenomenal to help us understand this pandemic. Appreciate everyone. Stay safe, and we'll talk again next week.